It is my honor to present the B2S Biofeedback and Stimulation System, a clinic-based, non-surgical pelvic floor rehabilitation device.
A two-channel biostimulation device that provides effective treatment for pelvic floor dysfunction and reduce urinary incontinence issues for patients. With a built-in software system and visual auditory guidance, it allows for convenient operation, intuitive workflow, and a clear treatment process. It possesses highly effective rehab modules which offer all-round care for pelvic floor rehabilitation, postpartum reproductive system recovery of women, as well as respiratory system rehabilitation. Introducing the software. Starting with patient registration and schedule services, then all the way to review and analyze pelvic floor muscle strength. Design essential software of the B2S Biological feedback and stimulus system can greatly enhance the workflow and simplify the process. The simple but effective treatment programs generate all-over stimulation for customers. The strong data management module allows you to manage the treatment data and patient information scientifically and statistically.
With a full 15.6-inch high-definition touchscreen monitor, it also has two channels for EMG collection and electrical stimulation. It's very mobile and can be moved to any flat surface.
Software.
There are 5 function modules on the main page of the software.
For a new patient, the first step is always to create the patient information. Except for the basic information, we can add some additional details such as the patient's pregnancy history, surgical history, family medical history, in order to make the info as detailed as the clinician needs. Standard screening.
Now we come to the module Standard Screening. It is the preliminary evaluation of pelvic functions, and it takes 2.35 minutes.
This module collects and analyzes surface electromyogram (SEMG) signals of pelvic floor muscles at 4 different stages. In these stages, the patient is asked to follow the voice instruction and the template on the screen to learn to contract and relax her pelvic floor muscles. This module provides intelligent scoring and a basic evaluation of pelvic health and neuromuscular function.
Now we come to the standard assessment. This module takes 6 minutes and 17 seconds.
And uses the International Glaser Protocol for the measurement of pelvic floor bioelectrical activity at 5 different stages. Scientific. It uses intelligent scoring and standardized reporting with nominative values to demonstrate patient's pelvic floor health status. Scoring shows patient's pelvic health level and provides reference for the necessity of rehabilitation treatment. And a passing score of 80 of 100 is required. Scheme treatment.
Now we come to the scheme treatment.
In this module, there are different predefined schemes for various PFD symptoms, such as stress, incontinence, and sexual disorder. You can see that each scheme is comprised of different programs, such as electrical stimulation, EMG triggered stimulation, and Kegel training. Each program is defined by its duration, number of work rest steps, ramp up, ramp down time, and pulse rate width.
Now we go to custom treatment.
In this module, treatment schemes can be tailored by setting biofeedback and electrical parameters according to patient's personal conditions.
Besides the treatment programs, we also have a fun and exciting alternative to pelvic muscle training. That is multimedia games.
The gaming training activates the patient's brain cells, improves recognition, and strengthens muscles in endurance, coordination, and balance. Postpartum rehabilitation.
We have postpartum and pulmonary rehabilitation schemes in this module.
We can also choose different schemes according to the patient's needs, such as lactation promotion, uterus involution, blood flow promotion, or respiratory function promotion. Instructions for use. First, connect the device to the power supply and press the round switch, which is the white button, on the lower right side of the display screen. Now, have the patient lie at around 45 to 60 degree angle on a disposable mat and bring the pants down to the knees. Before using the vaginal probe, you could apply some sort of gel to the probe to make sure that it has enough contact with the body.
Always insert it with the longer side upward so that the probe could be sited well between the labia, and the two stimulation parts are always aligned with the two side walls.
4. Connect the vaginal electrode to the short wires of channel A's lead and the reference electrode to the long wire. Insert the vaginal electrode into the vagina. 5. Connect the surface electrodes and reference electrode to the wires of channel B's lead, and then paste them to the skin surface. These two patches can detect the degree of the abdominal muscle involvement of the patient when she contracts or releases her pelvic floor muscles.